3, 2, 1. This video is going to be about applying kinesiotape to the neck. And typically when you are taping the neck, it's because there's either neck pain or a whiplash of sorts. And I have to tell you that the patients that have whiplash and you tape, they really, really like it. Neck pain, it's a hit and miss because sometimes if it's on too long, it can be an irritant, but more than likely than not, just general neck pain. I really believe, especially in the case of the neck, is less is more. So one of the things we can do is make a decision on the body and the person that we're putting the tape on, because these pieces of tape, they're pretty thick. So most whiplash and neck patients have pain in the neck that can transfer into the upper back or transfer into the shoulder blades and the trapezius and the area of the first rib. So what we could do is one big piece can come all the way across here. And I always recommend, again, don't even take the back off yet. Just say, okay, I think that one's gonna be good. I think I'm gonna use a long one. So let's just say now we've got that one on there and we wanna put one here and we wanna do another one here. So this is really long and not really necessary. And you have all these little tiny, wispy hairs here that you really don't want the tape to attach to. So you have two ways to get around that. One, avoid, just avoid attaching the tape on them. Two, keep a razor or shave them. If you've got a guy or something, girls aren't gonna really wanna shave their necks, but neck pain, maybe they would. But you could just do just the little peach fuzz wispies. I can see them. They're so little, but it would be worth it just to even get them off if you really are going to bring the tape up here, because when you go to remove the tape, it isn't very comfortable with it pulling those little baby hairs. So there's some options with that. My biggest point with this is to make sure that you are very cautious when applying the tape in the neck with the wispies and the little, they call them ducktails and things like that. So we got a couple options here. So we're gonna put one here for short. It's gonna come up in the lower neck and down into the upper back. It's like halfway. We're gonna find that. What's the first one we're gonna put down? And then we're gonna make a decision with neck pain. You could go this way. You could crisscross them. I have done that. That feels really, really good. So that's an option where it's coming up the neck and down into the shoulder and across. So it's gonna be 1, 2, 3. That's a lot of tape. Or let's say you only are gonna use 2 pieces. You could do one there, and you could do another one there. So I'm gonna rewind that. We're gonna cut that out. I'm just, hold on a second. I kicked the camera, I kicked the thingy, and the whole phone just started shaking.
Oh,
Okay. Very nice of me. So, we're gonna start back over. Oh, itch.
I have an itch, yeah.
I've got an itch.
I was like, don't reach it, don't move.
I know, that's horrible. Okay, so what was I saying? Oh, so if you only had 2 pieces and you didn't want to do this one, you could just do one here and then the other one here. So there's more than one way to put tape on people. This is really easy. I mean, this is simple, would be helpful. This is an easy way to do it. But I'm going to show you the more complicated way, because a couple things are going to happen in the complicated way is we're going to have to deal with clothing and we're going to have to deal with hair. So I might as well jump into the complicated one. So what we can do is have the patient or the person getting taped, yep, go ahead and just grab that. But what I don't want them to do is distort what's going on here. We're gonna rip, tear down the center. And then we're gonna anchor dead center. And then we need that arm out of the way because we need that shoulder relaxed. So wispies don't matter anymore. That hair that's coming down doesn't matter. We're gonna tuck this underneath like that and pull it through like that. And then no pulling here. We're just gonna let it attach itself like that. Same thing here. Lift, attach, drop across, drop around. I make it look easy. You'll figure it out. There. And if you're concerned that you're not going to be able to get around the clothing or just don't feel confident in that, maybe cut the pieces off and make them a little shorter. With this, we're not going to do the crisscross pattern. We're going to go basically up in the neck and down. And this is just too long. So what we're going to do is, honestly, you could do a half piece here, but I think the relief, to be honest with you, especially with a whiplash, is to start in the neck, come down, but go past here. So what we'll do is we're just going to cut off about 25% of this. Don't throw these pieces away that you're not going to use, because you will eventually share them or use them with somebody like a knuckle or something. And while you're at it, cut the other piece. And it's always good to maybe try to get them the same or similar length. So we're gonna go up the neck and down one side of the spine, and we're gonna do it this way. So just kind of get a layout before you take your backing off. Where do I wanna put this? Where am I gonna put this? We can see, I don't know if you guys can see it on film, she has all these wispies. There's hair that comes in her. So what we're gonna have her do is very gently, without moving the shoulders too much, just come up and just grab this side of your hair, not the whole neck. Yep, you're just gonna grab that. You can guide her a little bit. Now she's holding it up out of my way. Actually, drop back down. Go more center and then over. There. Here. Perfect. Now her thumb's in my way and we just don't want her to twist. So try to keep her neutral. Twist, release. We're gonna go way up at this end. We're gonna start up here. Just mostly for measuring sakes. And there's gonna be wispies in this one. And if you're concerned with that, we can trim those without trimming hair. This is definitely the more tricky one, and that's why that crisscross original pattern I was telling you about might be easier. But this, a lot of people do like this one if you go over and go through the trouble of doing it. Yep. So what I'm gonna do, you feel it? Mm-hmm. I'm just trimming the edges off, and it's just a little tiny edge and then a little tiny edge here. And she can feel it pulling because there's wispies up there. I'm just showing you how tricky this can be to do this one. So in case you decide to do this one, you may find yourself doing the other one instead. You can drop your hand. So that's the left one. Now we're gonna do the right one. We're gonna find that spot. We're gonna have her pull that hair up here. Pretty much, I'm gonna have you actually come a little bit more down and around towards the center. Yep, you just have like different, and then we're just, yep, and then she moved her thumb for me, and then I brought her back to center. We're gonna aim for the top piece. We're gonna start there. You can pull this all the way up. I'm gonna do it a little differently so you can see that there's a difference. And we can maybe do this. And attach that there, and it's there. And I don't have to trim it because I just applied it completely differently than we've done in the past. She can let go of her hair and relax her arm, and now she's relaxing all these muscles in here. And then I'm gonna attach this here. And I didn't have her look down. Some people like to have the patient look down. She doesn't need to. She knows that these pieces are here, and it is definitely supporting. So if she was to look down, which is what would be an irritant for a neck whiplash or neck pain, it's restricting. And so it will really give her the support she's gonna want through the day while this injury is healing. So this is the harder way and the more challenging way to do a neck kinesiotaping for a whiplash. But like I said, you have many choices.